Opened at the KICC in Nairobi, with President William Ruto presiding over the launch. The summit is showcasing key transformations in the health sector under the bottom-up economic transformation agenda, highlighting how a whole-of-government and whole-of-society approach is driving change. Discussions are focusing on universal health coverage, UHC, healthcare financing through the Social Health Authority SHA, the digitization of healthcare systems, and strengthening local manufacturing of medicines and vaccines. The summit underscores Kenya's commitment to building a resilient, inclusive, and innovative health system for the future.
The Primary Healthcare Act strengthened preventive and community healthcare while mainstreaming the place of our community health promoters. The Social Health Insurance Act replaced NHIF with SHA and established dedicated funds for primary health care, social health insurance, and emergency chronic and illness. The Digital Health Act established an integrated digital health system, and the Facilities Improvement Financing Act enabled public health facilities to retain and reinvest their revenues. Together, they transformed our healthcare in terms of financing, delivered and accounted for in Kenya, created the architecture through which we would finally translate Article 43 of our Constitution from a constitutional promise into everyday reality. We call this undertaking Taifa Care, as you all know. What followed has been transformational. And I would argue that alongside affordable housing, universal health coverage is one of the most consequential social transformations we have undertaken as a country. This achievement belongs, above all, to the people of Kenya. It is through your contributions, your taxes, and your participation that we have been able to make possible what our country has aspired for generations. Kwa hivyo, Taifa Care sio zawadi ya serikali kwa wananchi. Ni mfumo ambao Wakenya wenyewe wamejijengea kupitia kwa mchango wao wa mawazo, mchango wao wa pesa, na kwa ushirikiano ya Wakenya wote. I consider it one of the greatest privileges of my public service to have been entrusted in our time with helping turn that national aspiration into reality. Across the country today, 107,800 community health promoters are going from household to household, equipped with smartphones and essential kits to find illness before illness becomes a catastrophe, to register households, educate families, screen for disease, monitor mothers and children, identify danger early, and connect families to facilities. More than 9 million households have been reached by our community health promoters, and over 750,000 people have been referred for treatment. For the first time, we have built a nationwide health network whose first point of contact is not necessarily a hospital bed, but the doorsteps of a Kenyan home. We are reversing the old logic of waiting for people to fall sick, finding hypertension before stroke, diabetes before complication, a high-risk pregnancy before the emergency, and disease before disaster. The national government continues to match county government contribution to CHP or community health promoter stipends shilling by shilling. From this level, when a patient...
And now Homa Bay town member